in Beaverton.
We've been out protesting a lot of the things that are going on.
Lisa Stiller leads a community fight for change.
Our goal is to educate voters so that when election time comes, they make a wise choice.
She helps organize protests on social issues, most recently, rising healthcare costs.
It's just chipping away at people's pocketbooks a lot.
The Affordable Care Act subsidies are set to expire next month if Congress doesn't extend them.
With the subsidies possibly disappearing, people are going to be having to pay a whole lot more each month. And you're getting a subsidy because you are, low or moderate income anyway. So it stretches your budget. If your subsidy goes up $150, $200 a month, that's $200 less you have to pay for rent.
We talked one-on-one with an Oregon Health Authority expert about this.
Start with what exactly are the Enhanced Affordable Care Act tax credits?
Yeah, so premium tax credits were established under the Affordable Care Act, but in 2021, during the COVID-19 pandemic and when the American Rescue Plan Act was signed, Congress expanded financial assistance to more people and also gave more financial assistance to people who were already eligible.
So how many Oregonians currently receive these tax credits, and how many could lose this financial assistance if they expire?
So currently about 80% of marketplace enrollees, which is more than 111,000 Oregonians, are receiving financial help in the form of premium tax credits to help lower their monthly premiums. We estimate that nearly 35,000 people might lose financial help because their incomes are at or above 400% of the federal poverty level, so they would no longer be eligible.
So 35,000 people could lose this financial help.
That's correct.
Do you anticipate that many Oregonians becoming uninsured if these subsidies expire?
Most people are not going without insurance because they're still seeing a value of being covered. So what we're finding is that folks are actually just reducing their plan to a lower coverage tier.
The stalemate in Congress over whether to extend these healthcare subsidies caused the longest government shutdown in U.S. history. Democrats wanted the tax credits extended. Republicans wanted to deal with the issue separate from the government funding bill. Last week, Washington Democratic Congresswoman Marie Gluesenkamp-Perez had this to say about the ongoing debate.
Do you see that financial assistance expiring, or do you believe there will be a vote on that, as Republicans have promised?
What I've heard in discussions with, or with, secondhand about conversations with insurance executives, they're going to raise premiums. And look, like insurance premiums go up 25% every year. That's one of the reasons that I'm hesitant to say that this is the thing that is worth shutting the government down.
On Tuesday, Oregon Democratic Congresswoman Suzanne Bonamici told KGW.
And the message is getting through. We've had bipartisan conversations about extending the tax credits. I offered an amendment to extend them for 3 years. That didn't pass, but there are conversations about extending these. So I'm extremely concerned about this. I hope there is a vote.
Okay, so if Congress doesn't act and these tax credits expire, what is the estimated increase in monthly premiums for the average Oregonian?
The average loss would be about $960 for a whole year. And that equates to about $127 to $456 per month.
Rural and older Oregonians will feel that the most.
And for seniors, especially seniors who are moderate, low-income seniors, it's again the choice between food and housing.
Okay, so if you rely on Affordable Care Act subsidies and are wondering what to do, well, those at the Oregon Health Authority recommend talking with a state expert to find an affordable option, and that help is free of charge. Open enrollment for Oregon Health Insurance Marketplace runs through January 15th. But if you want your coverage to start on January 1st, the deadline to apply is December 15th. And you can go to OregonHealthcare.gov to learn more and be connected with an expert. But let's turn to the latest in D.C. when it comes to the future of these enhanced tax credits. The White House has said it would issue a new plan as soon as this week, addressing the rising Affordable Care Act premiums. Now, there were reports that President Trump was looking to renew or replace the enhanced premium tax credits. However, that plan was delayed, according to MS Now, formerly MSNBC, after it faced pushback from Republicans. Some Republicans telling reporters they would not be supportive of that plan, including Speaker Mike Johnson, who told CBS News that most House Republicans have, quote, little interest in that idea. We've reached out to Oregon's only Republican member of Congress, Representative Cliff Bentz, to see if he would support extending the subsidies. We have not heard back yet. Okay, but we want to hear from you. Do you rely on these Enhanced Affordable Care Act subsidies? Are you one of the 35,000 Oregonians who may no longer qualify? Let us know. We'd love to hear from you. Email us at thestory@kgw.com or call and leave us a voicemail, 503-226-5090.